talking about social determinants of health in people with intellectual and developmental disabilities. And today we're talking about healthcare access and access to quality healthcare. We know that, obviously, this has a big impact on a person's overall health and wellness. We know that people with IDD are less likely to get preventive type care, things like breast cancer screening, colon cancer screening, prostate cancer screening, cervical cancer screening, general preventive type dental care. And if we're less likely to get these types of things, there's more of a chance of having a negative impact on our overall health. We know that people with IDD have a higher incidence of chronic medical conditions, things like asthma and obesity and diabetes. Obviously, these things can impact health as well. People with IDD are at greater risk for negative long-term health outcomes, including things related to disability bias and health disparities as well. And we know that education of healthcare providers plays a big role in access to quality healthcare. And that's something that's lacking currently. Most healthcare providers do not receive education about how to provide health care for people with intellectual and developmental disabilities in their health professional training programs. And this is something that we're all working towards improving, but there's a long way to go. If a person is seeking health care at a clinician's office or an emergency department visit, and they're talking to a clinician who doesn't have training, they're not going to have access to good quality health care, right? So we need to do what we can to foster better education and training in medical schools, dental schools, occupational therapy, physical therapy, nursing schools, nurse practitioner schools, all health professional schools, so that clinicians are become disability competent and disability clinically competent to where they can provide good clinical care to people with intellectual and developmental disabilities. Join us for more next time.